if you're going to have a viral outbreak, I learned this week, this is a good place for it because in this state,
we love soap so much we scrub for fun. We are wash your hands in time. Yes, we are wash your hands in time.
this is a 2008 Washington State Health Department public service announcement that was about how to prevent the flu. Of course, there are many more cases, many more unconfirmed cases. The virus has been here for weeks. We know that now. We don't know how many people have it. First, the federally approved testing kits didn't work well. Then the FDA restricted which labs could run tests. Those restrictions are being eased as we get more testing kits. The University of Washington has canceled in-person classes for the rest of the quarter. Amazon and Microsoft have told employees to work from home. Okay for them. Meanwhile, there are people who can't afford childcare when their kid's out of school, can't afford to lose their job because there are no customers, people who can't telecommute. Speaking of which, KUOW staff are working from home, but radio shows require engineers and producers and broadcast equipment and hosts and panelists like you. So thank you so much for coming in.
Good to be here.
Happy to be here.
Have a disinfectant wipe on me. This week, your governor, Inslee, called it a patriotic act to stay home from work.
I didn't come to work Wednesday. I had a cough. I didn't come to work. And it's hard to do. Right? We're all wrapped up in our jobs. Our identity is in our jobs. So it's hard to do, but I can't stress how important that is and why that's sounds kind of weird, but it's a bit of a patriotic act right now of not going to work. But maybe we ought to coin a medal or something for folks who follow this advice.
And yet, as President Trump told Sean Hannity, not everyone's doing that.
You know, we have thousands or hundreds of thousands of people that get better just by, sitting around and even going to work. Some of them go to work, but they get better.
To be clear, I don't think you get better by going to work.
No, and the president tweeted that despite what we just heard with our own ears, he was not encouraging people to go to work when they're sick. So part of the mixed messaging from the federal government and the confusing and contradictory messages that we're getting from President Trump and Pence.
David, you've spoken to some of those people who are still going to work.
Yeah, I mean, I think the governor's advice is well taken, both by, general public and public health officials. It is good advice, but it does highlight and draw pretty stark attention to the fact that a lot of people can't not go to work. Washington, fortunately, for a lot of people, and Seattle before that, has pretty generous policies around and requirements around paid sick leave. So employers have to offer something, but that doesn't apply to people who work for app-based companies, gig workers, as many people call them, because those are technically independent contractors. And so, I mean, I think in theory, some of those people could maybe buy into some kind of paid family medical leave system, but most people don't because they don't make a lot of money. And so, for those people, hearing that it's a patriotic act to not go to work is I think a difficult thing to hear, because for them not going to work means they might not be able to pay their rent.
Paige, anything to add?
I was sick on Tuesday and I stayed home and I want a medal.
Sick how? What are we talking?
It was allergies.
Uh-huh.
It was just allergies. So fine.
Mm-hmm.
Well, it's really interesting. I mean, we just put up a story on Crosscut about Councilmember Deborah Juarez, who has multiple sclerosis and has been feeling not that well over the last few days.
Seattle City Council
member. And we talked for a long time last night, and she's, I think, was sort of struggling with the same thing. She has this guilt. She's an elected official. It's her job to be kind of out in front of this, but at the same time, she's not feeling well, and because of her multiple sclerosis, and the medication she takes for that has a suppressed immune system, which kind of puts her in the list of people who are particularly vulnerable to this disease. And so it's interesting to hear, even from, and the governor referring to him, how hard it was for him to just stay home because he had a cough. I mean, it's interesting to hear even elected officials kind of grapple with this. But I liked the governor's point about how much of our identity is wrapped up in our work and how hard it is to kind of give that up, because that's real. And at moments like this, you're sort of reminded that politicians are people also.
Senator Patty Murray has been calling attention to the fact that, as David said, we in Washington State, and particularly in Seattle, have mandatory sick leave policies. Employers have to give sick leave to most workers, as you said, not app-based workers and not some gig economy workers. But around the country, that is really not the case. And this morning, Senator Murray introduced a measure that I think has a co-sponsor in the House as well, that would give all Americans 7 days of mandatory sick leave plus. In the event of a public health emergency, employers have to give 2 weeks of paid sick leave. So that is not something that every American has a right to currently. And as this spreads, and we can see it spreading already most significantly in New York right now, but as this spreads, in states beyond Washington and beyond New York, I think you are going to see this issue of lack of sick leave in the United States become even more prominent.
Mm-hmm. Do we know if there are Seattle or King County proposals along these lines?
Seattle City Council member Teresa Mosqueda had said that she's interested in creating some kind of pool that app-based companies and the people who work for them could sort of pay into, that then further down the line they could access. But that is not an emergency measure. That is sort of a long, protracted policy battle that would require legislation. And so even she was, pretty clear that this is not something that would get up and running to respond to the coronavirus, but it is would be an attempt to get at that broader problem that Eli was just talking about.
And then there is the issue of paying for testing. Like there's more and more kits are coming online, so to speak. But Governor Inslee talked about some changes when it comes to the price of coronavirus test.
And then if you do have insurance, the insurance commissioner, here's someone who in normal times, labors in obscurity, right? But people might now be kind of grateful for the insurance commissioner they have in Washington. It's Mike Kreidler, and he issued an order, I believe it was yesterday or the day before, requiring all health plans in Washington state to cover tests and to waive copays, I believe it was, for coronavirus tests, and also to allow people, I think, one, re-upping on medications prescribed in this context. And it sounded like the Department of Labor and Industries came out with some additional coverage for frontline healthcare workers who end up getting sick and then have to miss work and have an L&I claim. That will be covered also.
But that only applies to state plans, right? So for bigger companies, I think that's correct, that bigger companies like Amazon, Microsoft, under those insurance plans, everything the insurance commissioner said, that doesn't apply.
Oh, I read it as applying to all healthcare plans offered in the state, but maybe it was only healthcare plans offered by the state?
It's offered in certain companies, but the bigger companies that somehow are within federal, it doesn't apply. So Microsoft, Amazon, Boeing, all the big ones.
Interesting.
No, if they do business across state lines?
Right.
Okay. I wonder whether people will we have, and this is unanswerable right now, I guess, but will there be a shortage of healthcare workers, and when it comes to something just like disinfecting, could I volunteer to help out, sort of act as a hazmat type, give me all the best equipment, and then I'm relatively healthy, I'm not above 60, I don't have an underlying condition, and that's probably illegal in some way, right? Yeah, wherever needed. If there's a shortage of the people, if the people who are going in are going down with confirmed cases, are we going to have a shortage, or can healthy people step up?
I think if you're showing up at the emergency room offering your services, I think that they'll probably say no, thank you.
Yeah, okay.
And that's part of the general advice that's going out, to stay away from hospitals and emergency rooms if you can, even if you are sick and experiencing symptoms, unless your doctor has told you to come in. That's if you're sick and think you have the coronavirus, to contact your doctor first and figure out where you should go and what you should do. And okay. It's a problem that, Knut Berger, a regular guest on the Week in Review, mm-hmm. wrote a piece in Crosscut this week, I guess, about the 1918-1919 Spanish flu pandemic and its impact here in Seattle. And this very thing was a problem then. Stay home if you're sick, but also go to the hospital if you need to. But if you go to the hospital, then you risk spreading it at the hospital, and the hospital can't serve people as well. This challenge has been familiar for 100 years, as much as people have been willing to think about it.
Let's talk about some controversies over which parts of, in this case, King County, are potentially going to be quarantining people. On Tuesday, the King County executive, Dow Constantine, announced that the county's buying at that time, unspecified motel that could be used for people.
Final negotiations to purchase a motel in which we can place patients who are in need of isolation and a place to recover. And we should have it available for patients by the end of this week.
And then we found out that this is the Econo Lodge on, was it Central Avenue? That we found out where the place is, and the mayor of Kent, Dana Ralph, objected.
We firmly believe this is an equity issue. The county intends to bring sick people from wealthier and less diverse communities and drop them off in Kent without regard for our community.
David, what did the county say about that?
Well, there was confusion around. I mean, I think the mayor had said that basically she wasn't told that this was happening. I think the county executive disputed that. I think this goes to show how challenging these things are, because this is kind of the point of declaring states of emergency or civil emergencies, is that it gives it a lot of power to executives and people at the top to make these decisions around zoning and siting and permitting and things like that. I'm not sure exactly what the thought process was to finding this motel, but things are moving quickly. They found this site, and I think the Kent mayor is making a decent point that yes, it would be unlikely, I think, for a lot of sick people to be moved into Laurelhurst or something like that. At the same time, I'm sure my sense is what happened is they just found that this motel was available. It had the right ventilation to put people in, and they acted on it. I think
that's what a county spokesperson said. This is the only motel on the market that met the public health criteria.
Which is
it's vented to the outside, not to hallways.
And I think it's not a coincidence that it is in a less wealthy part of town, and that's probably why it was available. It's sort of chicken and egg situation. I think there's also something else at play, which is the Kent mayor had, I think, told, or maybe in the press conference, I read it in the Seattle Times, said something about how she didn't want this to be something that would then turn into a long-term homeless shelter. So there's there are some other things at play as well that are similar kind of battles that we have been watching unfold here for years around. And this is what happens when there's just not a lot of space and not a lot of property available in our region.
Paige, you saw a similar response in North Bend, would you say?
Well, it's similar in that when they announced that there would be a quarantine site near North Bend, this would only be for healthy people coming back from traveling. The resident said, we don't want this site here. This is very dangerous. And this wasn't even for people who are sick, and it's in a very isolated community.
These were asymptomatic people,
right,
who were traveling through here. Right,
exactly. And looking back now, it seems so like such a long time ago, where we're thinking no one will come, no one's going to be sick, everything's great. And now we've gone from, an isolated place in the middle of the forest to a motel for sick people.
And also the county announced in White Center they were going to be placing on some county-owned land some modular kind of emergency housing that they could just drop there. And so the first two announcements in King County from the county were White Center for modular housing on county-owned land, and then the motel in Kent. And after that came an announcement of something that's happening in Inner Bay, and I think somewhere else north of the Ship Canal, if I remember right. So it seems a little more balanced at this point, but the first announcements were in, underserved communities, and inevitably led to this reaction of, well, this is unjust or maybe unfair. There's also, at least in my hearing, been a reaction of, well, why isn't King County doing something as forceful as what we've seen in China. And actually, far beyond Seattle, there's been praise for China's response. The World Health Organization has said that this was very effective. Well,
Shutting down airports, blockading railways.
keeping people locked in their neighborhoods, monitoring people through apps. China is an authoritarian society. And when you're an authoritarian society, it's easy to do sweeping moves like that. And so what you're seeing Dow Constantine do by declaring a state of emergency and buying a hotel and saying, I'm going to use this spot in White Center, I mean, it's analogous to what people are praising about the Chinese response. It's decisive and quick, and sorry, this is an emergency. This is literally what Dow Constantine has said. We are in an emergency. We don't have time for the normal Seattle process. So on the one hand, people want that kind of decisive, quick, quasi-authoritarian or actual authoritarian action. And on the other hand, there's this typical and sometimes justified instinct of standing up and saying, wait, is this fair? Can we process this? The answer from Constantine so far is no.
I spoke to interviewed a virologist this week, and again, there are many different opinions flying around. It's not like there's one right answer. This virologist I was talking to from Columbia University was saying that she wasn't alarmist. She was saying it's too late to do something like close down SeaTac Airport because the virus is here and it's spreading. And then she talked about economic disruptions. And there's no hard and fast. How do you make a calculation like that? You don't know what's going to happen, and how do you pick and choose among who pays the price?
Right.
It's just all very difficult.
And I think that's sort of the same. That's kind of similar to the debate that's happening about whether or not schools should be closed.
Yes.
Which is, you know, I mean, the reaction would be yes, because the immediate reaction from a lot of people, I think, has been yes, because it's a gathering of a lot of people in a fairly confined space. But, you know, King County public health officials have been saying, well, you know, sort of quantifying how disruptive that closing those schools would be is very difficult. You know, we don't have a ton of evidence that says kids spread this. We don't know if we close the schools, we don't know where the kids are going to go. We don't know what that means for the parents and how they would change their behavior and who they would interact with. You know, maybe some of these kids would go and stay with their grandparents who tend to be more vulnerable. So it's just, when you're sort of dealing with this stuff and making these decisions on the fly, which they very much are, I think actually sort of quantifying like what is causing the least amount of harm is really difficult.
Yeah, and you could say that about, there's a difference between an individual decision, a company decision, a bigger public health decision. As you say, if you close down a campus, well, where do they go? Maybe they become more widespread and fan out more than they would if they were just in one spot. You could say that about a company. You know, don't come to work is different from mandating that you stay at home, because if your employees now, instead of just going between work and home, for example, they go to a coffee shop because now they can telecommute, that didn't help.
Or I was driving by the University of Washington on the way here, and I was thinking about the UW declaring that they're not, you know, having classes or people meet actually in physical classrooms going forward. And so the number of students who are going to be in their dorms up for long periods of time, I mean, is that better in terms of limiting transmission? I don't know.
I really don't know. Yeah, we need to be careful here in saying many times, right. I don't know.
We don't know.
We don't know.
And the people who would know, our public health experts, are part of a system that has been chronically underfunded in this state for years and years and years, and is under greater stress because of that lack of funding.
Again, the school district that closed down for, I think it's 2 weeks for now, is the North Shore School District north of Lake Washington. Emerald City Comic-Con today postponed until this summer. Last minute, I mean, it was supposed to start today.
Right. And a bunch of vendors had already pulled out, so it was effectively postponed or canceled anyway,
right,
just by like the big vendors not being there. So that's interesting too. You're seeing that sometimes organizations aren't canceling something, but there's not enough people coming, so they're effectively canceled.
Right. One place that's actually open technically, the Life Care nursing home in Kirkland, the epicenter of the outbreak where most of the deaths have happened. There are 69 residents still there. 15 have been transported over the last 24 hours or so, but the county executive says the rest are staying put.
This is for many of the residents the best place that they can be, those who are asymptomatic, but have these health conditions that have to be attended to in a 24-hour care facility.
And some of those family members are complaining about a lack of cooperation or a lack of information.
Yeah, you're hearing the reports about at least one family member who was written up in the New York Times, walking around the outside of the building to the window of her mother's room just so she could see her mother through the window and check on her. I think the facility is open, but they are not, as I understand it, allowing visitors.
Right, that's right.
In the news, there was just a news conference this morning where I don't know who said this, but that they're going to start a process where some people can leave. But I don't know how that's gonna work in terms of who gets to and who doesn't.
The Attorney General, Bob Ferguson, noticed another issue with the coronavirus.
I'm reading consumer complaints from senior citizens who said they can't get out to the store. They're physically not able to do that. They've gone online, and hand sanitizers, which are normally $2, are going for $50 or $100 per pair.
His office is investigating someone. He didn't say who. He's asking, remember, they're just doing a general investigation. He didn't call anybody out. He's asking people to file complaints if you see price gouging happen, whether online or in stores. And this is a tough one. So there are, I'm sure, obvious cases of price gouging, but are we saying that a company that's seeing demand can never raise the price a penny? Maybe in a situation like this, maybe in a state of emergency? Absolutely not.
I think that was Bob Ferguson's argument, as I heard it. This is a public health emergency, and for a company to be charging $300 for a bottle of hand sanitizer violates, possibly, some consumer protection laws. There's another way around at least the hand sanitizer issue that Katie Herzog at The Stranger brought up. The constituent parts of hand sanitizer are pretty basic. It's rubbing alcohol and some medium to dilute it in, right? So,
yes. KUOW's recipe posted this week. Aloe vera.
Right, and that was exactly Katie's. It was that at a cup measure, but so the 2-to-1 ratio. But so if you search for KUOW's recipe or the Strangers homebrew recipe,
yes,
for parts are easier to find than the normal Purell packaged version.
But also, all of this is supposed to be secondary to washing your hands. Apparently, hand sanitizer is less effective.
You're also seeing gloves and masks being gauged as well. Right. So I feel like that's a bigger issue than hand sanitizer.
Yeah, I mean, it seems like we just see this a lot in emergencies, and it's a thing that, for some reason, we just can't seem to get our handle on. I mean, I remember after the shooting in downtown Seattle in late January, Uber and Lyft rides rocketed up to like $100 to get out of the area where the shooting had occurred. I think during some of the maybe Hurricane Harvey in Texas, I can't remember exactly which supplies, but some emergency supplies, cost of them were going way up. I mean, it's almost clockwork that whenever we see these emergencies, there is some reaction from the free market that as demand goes up, so do the prices.
Couldn't the government step in and make the prices go down? Just buy up a bunch of stuff, or if maybe they already have stockpiles and make that available for free? Why are we talking about keeping a price level instead of just, this is something the government can print money. They could make it available to all.
Well, that's socialism, Bill.
Oh, yeah, that's China. We're back to China.
No, I think the government, it does stockpile emergency supplies theoretically. That's what they have told us, and I believe it. And the purpose of that is to step in instances like this. And part of the criticized federal response so far, as I've heard it, is that this stockpiled material has not arrived quickly enough. I think part of Mike Pence's visit to Washington State, was that yesterday? A lot's been happening. So that was yesterday, and he showed up in front of a whole bunch of pallets of the N95 masks that I believe were from the government stockpile and were now arriving, in honor of his visit. So that's starting to come through, the release of emergency materials from the stockpiles. But like the testing, the criticism is it hasn't happened quickly enough. In terms of the public, trying to buy things on Amazon, and your mention of what happened with Lyft and Uber rides after the shooting, it made me wonder, are the algorithms that, help these electronic service platforms set pricing contributing? They're not human, and so they just sense an increase in demand and a shortage of supply and an opportunity, and they jack up the price.
Yep.
But meanwhile, the city of Kirkland they've ordered masks and gloves, and it's all back ordered. Yesterday, when I looked at the Emergency Operations Center, there was a logistics person on the phone with Amazon asking, how quickly can I get this? So there's all this talk about consumers, but then the cities and the people who arguably need it more are affected too.
Yeah, the two things seem like different. It does seem like with Uber and Lyft, it was sort of an algorithmic problem. Amazon, this sort of goes into their other struggles of just not really having great control over what people are selling on their marketplace or how they're selling it. I mean, you see people selling, Nazi paraphernalia and things like that online, and yeah, I mean, the thing about emergencies like this is it tends to take pre-existing issues and things that are already really thorny and complicated and just totally magnify them times 100, and we start to see where these weaknesses really really matter and make a difference to people's lives.
And this goes back to working from home. We all want these things to be delivered, but someone has to deliver them.
Right.
They can't work from home.
Right.
Yep. The last week or two on KUOW, on the record, I've been interviewing epidemiologists and public health experts and virologists and others experts. We are not experts here on the Week in Review today. We're journalists. We've been gathering information for you. Eli Sanders from The Stranger and David Kroman from Crosscut, and Paige Cornwell from the Seattle Times, and we've just been conversing a bit about this. Personally, I've been wondering, it's come up a few times just in this conversation, I've been wondering how many of the changes that are happening now because of this outbreak will last and become permanent, whether it's will school teach remotely more than ever? Will the right to public education mean the right to broadband and other equipment, because that's what education is anymore? It starts to become. The CHI Franciscan Health System here locally is offering free 24/7 virtual health consultations with a certified provider to people experiencing upper respiratory symptoms suggested of a COVID-19 infection. It's called 24/7 Virtual Urgent Care, and you can use it online or get the app from Apple and Google. Use the coupon code COVID-19, they say. It's not an ad, but will telemedicine become more widespread? If we lean into long-distance connections, will it change where people live? We brought up the right to sick leave. Will that become something that's not just on an emergency basis? You talked about the possibility of a long-term homeless shelter in Kent coming out of this motel purchase. We talked about authoritarianism, China style, right? I just wonder how we're going to look back at how things have changed because of this outbreak.
And way down the list, but something people have talked a lot about this week, traffic. Driving around is quite different right now with a lot more people working from home. And, no one wishes this as the way of finding that out. But on the other side of this, which we hope is soon, does the idea of more people working from home when they can, or maybe in staggered ways, become a solution to the chronic traffic problems?
Yeah, if people who can work from home for several reasons, logistical, financial, if they do, that helps people who can't work from home and have to fight through the traffic.
In Seattle, it seems it's really brought up to the surface even more than usual. The haves and the have-nots are the ones who can work from home, the ones who can't. And you're just seeing that so much right now. The ones who have the luxury to just stay home and say, I'm a patriot, like me. And the people I want to have deliver my food if I'm not feeling well.
Yep.
Also, hand washing. Maybe we'll all keep washing our hands.
Right. Will that stick around?
And
is this the death of the handshake? Is the handshake gonna be gone? It's gonna be elbow bump or just namaste. No more
Paige.
elbow. We don't have to touch somebody to say, hello, I recognize you as a fellow human. I wish you well.
Paige is pushing the namaste.
I'm
Is that right?
thinking it also, Well, first at Bellevue College, where I was earlier this week, someone mentioned that they had to change the boys' bathroom soap canister for the first time in 5 years. They've never had to do that before. But someone else also brought up, let's all do a Japanese style of bowing. Why don't we all do that?
Happy to bow. I went from an elbow bump was a rare thing, and someone who I interview a lot of people. Someone would come in, they're on a book tour, maybe they're sick, and it's no big deal, but it's that little just slight awkwardness of, well, we're going to do this thing, and it took me one day before I'm elbow bumping everyone. I'm not even thinking about it. I forgot what a handshake is. So why not the bow? Why not the namaste?
One thing.
What else before we wrap up? Yeah, what else are we
I was
thinking
going to
about?
say, what this period has also. That was a nice, fun little conversation. Now I'm not about to make it serious again, but
That's okay.
what this period, this sort of state of emergency, I think has also done is, in 2015, Seattle and King County declared a state of emergency around homelessness, and we are still technically under that state of emergency. That was never lifted, and so I think what this has done also is sort of shown what government is theoretically capable of when they really need to do something and do something quickly. I mean, we're seeing people ask for $100 million, and there's this federal package of $8 billion coming in, and purchased a hotel and got these modular units, and they expanded the tiny home villages, or going to expand tiny home villages for people experiencing homelessness. And that has also raised some questions, which is, what was the point of declaring that first state of emergency if we weren't actually going to take advantage of it? And I'm not sure people totally understood that it wasn't necessarily being taken advantage of until we have now witnessed what is being treated like a real emergency actually looks like. So I'll be curious to know if once this has kind of died down a little bit, if we hear sort of louder and more persistent cries for, if homelessness is in fact a real state of emergency, do what you just did for the coronavirus.
Mm-hmm. Yep.
And kind of blending what Paige brought up about the class divide and what David was talking about our continuing homelessness emergency, I've been thinking that in a way, amid all the current misfortune, there is some fortune in the fact that this disease, so far, at least as we know it, is hitting people who are higher on the class scale, people who can afford international travel to start with, right? And then people who we hear about who have healthcare and who have gotten tests. And it then implicitly brings up the danger, the very big danger, that this could begin spreading among people who don't have houses, never mind health insurance, in our very large homeless community. And you've heard some leaders in Seattle kind of begin to talk about the steps that they might take on this, but the problem is there because, as David said, we've had a state of emergency around homelessness forever, it seems like, and not enough has been done. And now there's this very large pool of people who are extraordinarily susceptible to COVID if it migrates to the homeless community.
Should we pause there for now? It's not like we're not going to be talking about this all next week and the next week in review and many more. We've been talking about the coronavirus outbreak, of course, with Crosscut City reporter David Kroman, Stranger associate editor Eli Sanders, Seattle Times East Side reporter Paige Cornwell. We're on Facebook Live, so you can telewatch the show. And oh, by the way, did I mention we're voting for president this week? Yeah, so that'll come up too when we return to the Week in Review. KUOW, I'm Bill Radke with Crosscut's David Kroman, The Stranger's Eli Sanders, the Seattle Times' Paige Cornwell. And we are going to take a little break from our coronavirus craze because there's a president thing going on. And if you haven't already voted, you have until Tuesday. If you're voting Democratic, wow, who's it going to be? I mean, just look at that ballot. Are you going to vote for Bennett, Bloomberg, Booker, Buttigieg, Delaney, Klobuchar, Patrick, Steyer, Warren, Yang? Or, I know.
Radke.
Radke, why not? or you could vote for somebody who is running for president. That would be Biden, Sanders, or technically Tulsi Gabbard. So, who do you think Washington State's going to vote for? Do we have any indications yet?
I'm willing to go out on a limb and make a prediction.
Yeah.
And this is so dangerous after 2016 and in the current environment where, polling doesn't work and things change wildly by the minute. So to give myself those caveats, I will say I looked back on the results from 2016 when Washington State had a caucus for the Democrats that was determinative, of a lot of delegate apportionment. And Bernie Sanders won the caucus with more than 70% of the vote in the caucus. But then we had that non-binding statewide primary for the Democrats afterwards, and Hillary Clinton won that. Now, because people were very concerned that caucuses were exclusionary, were, hostile to people who have disabilities or who just have jobs that require them to work on Saturdays, we don't have caucuses anymore. We got rid of them. And all we have is a statewide primary. So if you kind of map the Hillary Clinton support onto the Joe Biden support, which I think is logical to say that there's probably about as much support for Joe Biden as there was for Hillary Clinton statewide, that suggests he has a pretty good shot in a head-to-head matchup with Sanders. And then if you add in what's been happening over the last week, all the endorsements for Biden from people who were in the race, and this sort of coalescing among a lot of Democrats around the idea of, okay, this is not a perfect candidate, Joe Biden, but Trump's not perfect either. And he seems, Joe Biden, like the best chance that we've currently got against Trump will, pick him even though he was not our first choice. If that dynamic continues, I think it's pretty reasonable to expect Biden to win Washington, even though it's such a hotbed of Bernie Sanders support.
Other takes?
Jenny Durkin just endorsed Biden, right?
Yeah. Right before.
When was that? This morning? Mm-hmm. Okay.
Yeah, I don't.
Durkin bump.
I'm not going to make a prediction because I don't like to eat crow later. In case I'm wrong, which I'm never wrong, but
not putting the crow in Kroman.
Yeah,
go on.
But we did a poll a couple weeks ago, and I mean it might as well be a totally different universe at this point because this was before Nevada and before some of the debates. I'm not sure it gives us actually a great picture of where Washingtonians are at right this second. But one thing that stood out to me about that poll was there was like 20% of people who were undecided, which is a pretty big number. In fact, I think that was the biggest block of people in our poll, even more than any of the individual candidates. I mean, this was when Buttigieg and Klobuchar and Bloomberg and were still all on the ballot. Warren were still all on the ballot. But I think that does sort of suggest that there, that doesn't read to me that Washington is a, like Eli said, necessarily a big hotbed of diehard Bernie fans if you have that many people who are still undecided. And I think that could, considering the success of Biden over the last few contests, I think it's a fair bet that a lot of those people might start swinging towards him.
Here's a little, or not so little, logistical thing that I think also works in Biden's favor. So we have this new binding statewide primary. Also, in order to have your vote count in the primary, you have to mark on the ballot whether you prefer the Democratic Party or the Republican Party. There are currently, Rich Smith the Stranger found this out and wrote about it this week, I think something like 40,000 ballots that have been sent in where people said, I don't want to tell the government which party I like, or I don't want to mark this thing because I know it's going to be used for marketing purposes, which is true. The parties are going to get these lists of people who declared Democratic or Republican allegiance and then send them mailers, around the next election time. And a lot of people just don't want that.
Or just didn't notice.
Or they are on the left, but they are not like establishment Democrats. That's not how they see themselves. And so who are the people who are more likely to have a problem on that score checking a Democratic box? It's a Democratic socialist or a socialist, which there are plenty of in Seattle. And I think the Venn diagram of those people and Bernie supporters, there's a lot of overlap there. And I think that may also end up hurting Bernie's count here.
That also might mean that a Biden victory might be somewhat less of a sign of Biden love than you might think. If a chunk of people are socialists, and you might not, therefore they might not swing behind Biden. In the
well, we'll
general.
have to get the count on how many ballots after the election were turned in, but their vote was not counted because they refused to either check that Democrat or Republican box.
And isn't it true that you can, if you did that, for example, you can request it back? I believe there's some new rules. So I wonder if anyone is going to use that to their advantage, maybe? I don't know if that was probably too far out for that. But maybe more people are inclined now. Like, never mind about the not caring about the establishment. I want my ballot back.
Yeah, a little public service before Tuesday. You can cure this error on your ballot. So if you're a person who sent in a ballot, didn't mark Democrat or Republican, and didn't realize it was going to make your vote invalid, you can actually just Google Rich Smith and the Stranger and ballot stuff, and I think you'll get a story explaining what you can do. Or you can contact King County Elections if you're in King County or the state. They'll tell you how to cure this error.
But that's not true if you voted for someone who's dropped out. You can't take that vote back.
No, and it's only if you didn't put something. So there was this, I have idiot Facebook friends, but some people were, just kidding if you're listening, but they were putting on, oh my gosh, like if you voted for someone who's dropped out, you can vote again. And that seemed to be gaining traction, which maybe might.
But you said it's only if you voted for no, like if you didn't declare a party, but you and you voted for someone, does that mean you can take it back because your vote for someone who's dropped out didn't matter because you didn't claim a party?
That is a very good question, and maybe a ballot loophole. But I would guess what they would say is, no, Bill, your vote for Tulsi Gabbard is still going to count once you fill in.
Well, she's still in the race.
Yeah. Okay.
But
so
if I had voted for
your vote for Andrew Yang,
yes,
closer to the truth.
So do you get a new ballot?
If you fill in your Democratic bubble.
So do you get a new ballot then, or?
What I was reading is that at least in King County, you can do something online that will resolve the issue. But I don't know if that's for every county, and you should check with your local elections department.
So between coronavirus and so many candidate dropouts, are we going to end up getting is Washington going to have a bigger say in this year's race? Are we going to end up saying that was a success? We moved it up.
I mean, I would say if Joe Biden does win, I mean, Washington, that would be a fairly significant thing for the race, because it's not like a clear one way or the other thing. So, I mean, Washington's not going to be decisive by any stretch, but compared to the role we've played in past elections in which we've had a caucus and it's been much later in the cycle, it will matter more than that. It will matter not an insignificant amount.
But other states like Michigan are still going to take the spotlight. We'll just be in our corner like we always are.
We're not swinging enough for the national media.
We're maybe more of I would say our significance would be more as a bellwether rather than the number of delegates. If Biden wins it easily, I'd say that looks fairly badly for Bernie Sanders for the rest of the country. If Sanders wins here, then, maybe he still has a shot.
I think a thing that will be a benefit of this statewide primary at this date, but more the fact that it's a statewide primary, is that we will have a clearer picture of which part of the left the Democrats in the state actually occupy. The caucuses were distorting because only diehard partisans showed up, and like we discussed, people who didn't have to work on a Saturday, so more upper class people and people without disabilities and so on. So it painted a distorted picture of who Washington is, or where on the left spectrum Washington sits, and some people's senses of what shade of blue they live in may be disrupted by the results of this statewide primary. I think it's not going to be as far to the left as the caucuses were.
Did the Stranger endorse anyone yet?
The Stranger did. The Stranger endorsed Bernie Sanders. And so I guess we'll also find out the statewide pull of the stranger endorsement.
The stranger's not on board with the unite behind Biden.
Well, the stranger, like everyone
theory.
else, is has to live in this world where it's hard to keep up. So we endorsed Bernie, I think, weeks ago.
Okay.
And a lot's happened since then. I'm not saying that doesn't change our endorsement. Our endorsement is our endorsement, which is Bernie Sanders. But the whole swing to Biden thing had not even happened when we made our endorsement.
You could have done what you did in 2016 where you endorsed both of them.
Yes. And so close observers of the stranger will note we did not do that. We took a step away from that. People did not like it when we split our endorsement between Hillary Clinton and Bernie Sanders in 2016. So this time we actually made a choice, which is what voters have to do. So it's only fair.
Yeah, the New York Times got dragged for that, I believe, pretty recently. Okay, so
The New York Times.
we'll wrap that up. I got to, even the presidential primary comes back to coronavirus. First of all, what a time. If you're going to go from in-person caucus voting to mail-in voting, excellent timing on Washington State's part. Although mail-in voting is not completely safe, the Secretary of State asks that you please not lick your envelope. That's true.
Yeah. Use a sponge.
Use a sponge.
How long can the virus live on an envelope? Do we know that?
Well, we don't want to find out.
Yeah.
I think that's low on the list of studies.
Yes, exactly. We'll get that when we get to it. We'll get around to that study. Okay. By the way, I've heard 9 days on surfaces, but I don't know if it depends on the surface.
9
So
days.
once again, I'm out of my lane. Okay, we're going to be right back with more of the Week in Review.
$12:53. This is 94.9 KUOW, Seattle's NPR news station. Sound stories, sound voices. It's 12:54. Rainy and 41 degrees in Seattle. Chance of showers sticks with us all day and overnight. Should reach a high today of 47, overnight low 38.
We live in a world of questions.
Who? What?
Finding
When?
the answers
Where?
starts with listening.
I've listened to KUOW 24/7.
And KUOW is where you'll hear the sound of our democracy.
We have 2 Morning Edition hosts in Iowa. They're asking voters.
Subscribe to our elections newsletter at KUOW.org/elections to find information that will help you make smart decisions for our communities. Together, we are Seattle's NPR news station. KUOW 94.9 and KUOW.org.
Support for KUOW comes from Washington's Lottery, supporting communities throughout the state. From education to local retailers, from CenturyLink Field to lottery winners, Washington's Lottery helps contribute to the well-being of others with its proceeds. Learn more at waalottery.com.
Okay, before we leave KUOW's Week in Review, a couple of updates. Paige, we talked last week about a mural at Bellevue College defaced by one of the school's vice presidents. The mural depicted 2 Japanese children at an American internment camp, and the vice president had whited out a sentence in the mural's description that described a Bellevue businessman that had supported the internment back at that time. What's the update?
The update is that both the president of Bellevue College, Jerry Weber, and the administrator, Gail Colson-Barge, they both resigned this week.
And do we yet know why? Who did the defacing or the altering and why?
The investigation now, according to the Board of Trustees of Bellevue College, they believe that Dr. Barge ordered someone else to alter the art, but they don't believe that anyone else knew about it at that time. She still has not offered any sort of motivation. She did apologize and say that she regrets anything that happened, but again, hasn't said why.
Yeah, we don't know if anyone asked or ordered Vice President Barge to order.
Exactly.
We don't know. Okay.
Well, she says that she did it on her own.
On her own.
That
Okay.
seems, who knows.
Okay. So finally, if you're going to have a viral outbreak, I learned this week, this is a good place for it because in this state,
We love soap so much we scrub for fun. We are wash your hands in time. Yes, we are wash your hands in time.
this is a 2008 Washington State Health Department public service announcement that was about how to prevent the flu.
Visit Wash Your Hansington, where people wash their hands, cover their cough, and get the flu vaccine.
This is the state of the evergreen and impeccable hygiene. We love it when our hands are clean.
By the way, those hand claps are happening underneath faucets in the video as people scrub up and then clap, spraying soap all over the place.
Wash Your Handsingtonians are always friendly and germ-free. They love to give high fibers, not high fevers.
That actually was true. We did prefer high fivers, but now in 2020, it's, as we said, all about the elbow bump, or even better, the hands-free bow or namaste. And remember Eli's rubbing alcohol recipe.
We cover our coughs, every single one. We are Wash Your Handsington. Yes, we are Wash Your Handsington. Wash your Handsington.
And just when you think it couldn't get better than that, a Seattle gospel group, the Total Experience Gospel Choir, did their own version.
We love soap so much we scrub for fun. We are Wash Your Handsington. Yes, we are Wash Your Handsington. Wash your Handsington. This is the state of the evergreen and impeccable hygiene. We love it when our hands are clean. Wash your Handsington.
Hallelujah. Thank you, my fellow Wash Your Handsingtonians.
Thank you, Bill.
What have you done?
I'm not sure what it says that I've never heard that song before.
You've never heard? You didn't know that this is people all around the world know this state as Washing Handsingtonian or whatever it was. Washing Handsington.
How much times have changed in PSAs. You remember a couple of months ago when we loved the insult comic fish PSA?
Yeah, the salmon transit.
Yeah.
Whatever that was, yeah.
The mean salmon that was telling people to carpool.
Yes. The mean salmon NHL. I like that. Okay, this has been the Week in Review with a group of excellent journalists who also come in person and talk about the week's news. Thanks a lot.
Thank you, Bill.
Thank you.
Thanks.
That is Stranger Associate Editor, still Pulitzer Prize winner, Eli Sanders. Seattle Times East Side reporter, Paige Cornwell. Crosscut City reporter, David Kroman. Come back again soon, okay?
Will do.
Deal. This show is produced by Sarah Leibovitz, Facebook Live production by Juan Pablo Chiquiza, just a couple of the other KUOW employees, our engineers, our producers, our board operator, Bernard Ouellette. Thanks to everybody who comes in. Thanks to everybody who works from home to keep you posted, too.
We love soap so much we scrub for fun. We are Wash Your Handsington. Yes, we are Wash Your Handsington.
Visit Wash Your Handsington, where people wash their hands.
This is KUOW-FM Seattle, KUOW Tumwater, KQOW Bellingham. It's 1 o'clock. BBC NewsHour coming up next. Expect rainy conditions today, tonight, and tomorrow.
Support for KUOW comes from